بسم الله الرحمن الرحيم. الدكتور أزهر الحافظ جابر، كلية طب الأسنان، جامعة بابل، فرع العلوم الأساسية. عنوان المحاضرة Cholinergic Antagonists or Anticholinergic Drugs. هذه المحاضرة ضمن المنهج التدريسي لطلبة المرحلة الثالثة في كلية طب الأسنان جامعة بابل. Cholinergic antagonists or anticholinergic drugs. These drugs bind to cholineceptors but do not trigger the usual receptor-mediated intracellular effects. Acetylcholine act on the nicotinic receptors which are present at the ganglia, whether parasympathetic or sympathetic ganglia, and it acts on the adrenal medulla. And it acts also on nicotinic receptors at the neuromuscular junction. Other effector organs, it acts on muscarinic receptors at the postganglionic, at the end of the postganglionic neurons. So that drugs which oppose or antagonize the action of acetylcholine at each site can be divided into three. First, anti-muscarinic drugs, which act principally at postganglionic cholinergic nerve endings, which are called also atropine-like drugs. They will block the sites, the muscarinic receptors on which the acetylcholine act at the effector organs. This figure shows the size of anti-muscarinic drugs action. Muscarinic receptors can be subdivided according to their principal sites, namely in the brain and gastric cells, M1, heart, M2, and glandular and smooth muscle cells, M3. M4 and M5 are of unknown size, but there are some researches about their action, and some of these researches shows that they are present in the neural tissue or other sites. Anti-nicotinic drugs, that is ganglionic blocking agents, these drugs shows preference for the nicotinic receptors of the sympathetic and parasympathetic ganglia. They act on nicotinic receptors which are denoted as N sub N, which are specific for the ganglia. The third, neuromuscular blocking agents, they interfere with the transmission of efferent impulses to skeletal muscles, and they block the nicotinic receptors at these sites, and they are denoted as N sub M. So this is the site of action of ganglionic blockers. They block the nicotinic receptors at the ganglia and at the adrenal medulla. And the site of action of neuromuscular blockers, they inhibit or block the action of acetylcholine on nicotinic receptors at the skeletal muscles, that is at the neuromuscular junction. We shall discuss in some details the anti-muscarinic drugs or agents. These agents block the muscarinic receptors, causing inhibition of all muscarinic effects or functions. The prototype of this group is atropine. Atropine is an alkaloid from Atropa belladonna, which is a plant. It has a high affinity for muscarinic receptors, where it binds competitively, preventing acetylcholine from binding to these sites. It acts both centrally and peripherally. Pharmacological actions of atropine. These actions are the opposite of the actions of acetylcholine and include exocrine gland, decreased secretion of salivary, lacrimal, gastric, bronchial, and sweaty glands. Smooth muscles are relaxed. GI tract, reduction of the tone and peristalsis. On the bronchial tree, bronchodilation. On the urinary bladder, micturition is slowed and the urinary retention may be induced, especially in cases of prostatic enlargement. The actions of atropine on eyes. Let us summarize some of the anatomical facts of the eye. We have the ciliary muscles of the eye. They are supplied by muscarinic receptors, and when they are contracted, they opens or increase the openings of trabecular meshwork and improve the drainage of the aqueous humor, denoted by this dark line. Improve the drainage of aqueous humor through the canal of Schlemm, which is a venous sinus, the canal of Schlemm. This is more closer and more clear view. This is the trabecular meshwork, and the longitudinal muscles of the ciliary body, when they are contracted, these fenestrations will be more large and improve the drainage of the aqueous humor through the canal of Schlemm, which is a venous sinus, canal of Schlemm. Also, muscarinic receptors are present at the sphincter muscles of the iris, and when they are contract, they produce miosis. This figure summarizes the action of anti-muscarinic agents, particularly atropine, on eyes. This is at rest position, and here the circular muscles are denoted in red line, also here and here, and the longitudinal muscle fibers of the ciliary muscles are denoted in red lines, also here and here. Anti-muscarinic drugs produce mydriasis, that is increased in the diameter of the pupil, and paralysis of the ciliary muscles, so that the eye is first accommodated for far vision because the curvature of the lens is decreased, and the increased intraocular pressure, the IOP, because the previously mentioned its effects on the fenestrations of the trabecular meshwork. These fenestrations will be closed or nearly closed, so that the drainage of aqueous humor is impaired, so that the intraocular pressure is increased. Also, light reflex will be lost. That is, application of light on the eye does not produce miosis because the sphincter muscles of the iris are paralyzed. Accommodation for far vision, near vision is blurred. On the cardiovascular system, atropine increases the heart rate and enhances the conduction in the bundle of His. No significant effect on peripheral blood vessels in therapeutic doses of atropine, but in poisoning, marked vasodilation may occur. On the central nervous system, atropine is effective against both the tremor and rigidity of Parkinsonism. It prevents motion sickness. From all these pharmacological actions, we can summarize the Therapeutic uses of atropine. First, ophthalmic uses. It is used to induce mydriasis and cycloplegia, that is paralysis of the ciliary muscle, which permits the measurement of refractive errors accurately. It may induce an attack of glaucoma in susceptible individuals. The second therapeutic use, atropine is used as antispasmodic agent to relax the GI tract and urinary bladder. The third indication or use, it is used as antidote for cholinergic agonists. Atropine is used in the treatment of overdose of choline esterase inhibitors, insecticides, and some types of mushroom poisoning, which contain cholinergic substances that block choline esterase. The fourth indication, anti-secretory agent. It is used to block the secretions in the upper and lower respiratory tract prior to surgery. Side effect of atropine: dry mouth, blurred vision, tachycardia, constipation. On the central nervous system, it may produce restlessness, confusion, hallucination, and delirium, which may progress to depression, collapse of circulatory and respiratory systems, and lastly, death. It may induce or exacerbate an attack of glaucoma in elderly patients with latent condition. This is the end of the lecture. Thank you very much for your listening.